Namaskar. I am Dr. Shashank Vashisht, ENT specialist at Manipal Hospital, Palam Vihar, Gurgaon. Today we are going to talk about seasonal allergic rhinitis. So, what is seasonal allergic rhinitis? It is basically allergies which flare up during change of season. We call them hay fever as well. Now, the reason we are talking is because the season is changing now. A lot many patients complain of problems, and to distinguish between allergies and infection is also very important. So, what are the typical symptoms the patient presents? So, typically, patients say they have congestion of the nose, sometimes irritation, watering, and running nose. Also associated with sometimes running or itchy eyes, throat irritation, and sometimes cough. These occur especially during change of season as we are approaching spring, so these allergies flare up. These flare up is mostly due to the pollens which are into circulation these days as the new flowers are being blossomed and these pollens are circulating in air. Now, these pollens, when they come into contact with the respiratory passages of a patient who has allergic tendencies. So, by allergic tendencies, we mean patients who have a genetically predisposition to these allergens. So, when these patients come into contact with these pollens, they manifest all these symptoms, and the symptoms are quite violent. Quite violent in the sense that they flare up very fast, and these patients they do not know whether it's an infection or an allergy. They actually end up taking antibiotics, which are actually not required. Now, how we diagnose these cases? Yes, there is a classical history that there is a family or familial or there is a history in the family of allergies. So the parent or siblings they may have had an allergy episode. Allergies of the nose, allergies of the eyes, sometimes allergies of the skin. Allergies of the chest are also known as asthma. So these history they predisposes one to develop such interactions. Secondly, these patients they say that they have an itchy eyes, itchy nose, nasal congestion, symptoms which are persistent to the nose. Sometimes symptoms persist to the throat, where the throat irritation, some mucus which is dripping down the throat. Sometimes they have a dry cough, which is more at night. So these symptoms they also point towards allergic. Also, these patients do not have fever, so that is a very good differentiator that allergies patients do not typically have fever and they do not have other constitutional symptoms like body ache, fatigue, headache, which are commonly seen with viral infections. Now, how do we diagnose? Yes, the history is important. Also, there are certain tests by which we can prove to the patient that he or she is allergic. So, these tests are called allergy specific tests by which we test the IgE antibodies. So, IgE antibodies are basically antibodies which are secreted in blood in response to the allergen. So these antibodies are allergen specific. For example, if a patient is allergic to say cockroach, so he have an IgE antibody which is specific against the cockroach and such antibodies can be measured in blood test. So let's talk about the common allergens as well. So pollens are one, but there is something called house dust mites, cockroach, pet dander. Dander is basically the dry shed of skin from the animals, especially cats and dogs. Pollens, grasses, all these things are typical known allergens in the community. Now, by doing blood tests, we can establish the diagnosis that these patients are having allergies and which allergy is present, means specifically to which allergen. Also, there is something called known as skin prick test, whereas we inject some part of allergen onto the forearm skin of the patient and we measure the response. So, these tests also confirm the causative substance of allergy. How we treat them? Yes, prevention is the first and important thing. So, especially in changing weather, when patient knows he or she is going to have allergies, they should avoid contact with these allergens. How to do that? Firstly, is when they are say moving out in the park or taking a stroll, so they should wear face mask. Face masks prevent inhalation of allergens into the body. Secondly, if they go and play like children, so they should come back, wash their hands and mouth, and also change their clothes. Secondly, dust mites. These are common mites which are settling on the bed sheet and pillow covers because they travel through dust. So one should ensure that dust doesn't settle on the pillows and the bed sheet or mattresses, and one should cover these pillow mattresses so that the doesn't settle on it. Yes, if they are pets which are known to cause allergen, then one should avoid interacting with pets, uh, which is sometimes not possible, but at least one should make an effort that these pets, they do not climb onto the beds of the patients, and they should not enter the room where the patient sleeps. Yes, what is the treatment option? The treatment option, yes, prevention is first. Second is we do something known as symptomatic treatment, which means we are trying to undermine the symptoms which are causing trouble to the patient. So these medicines are typically known as antihistaminic medicine. Histamine is a chemical mediator which is released in the body when body is coming in contact with the allergen. So antihistamine prevents that interaction and the histamine is not released. So the symptoms of the patient, they are relieved. Other medicines are in the form of sprays inside the nose. So these sprays are basically anti-allergic as well as anti-inflammatory. So these are given in the form of nasal sprays, and these reduces the inflammation in the nasal passages and reduce the formation of sneezing, mucus and cough. Patients who have chest allergies, they are also given inhalers, so they also reduces the incidence of cough as well as any tightness on the chest, which can be due to narrowing of the breathing passages. Also important to talk about something known as immunotherapy. It's a very latest treatment, but this treatment is given to patients who have very specific known allergen, and this basically is a desensitization test. So how do we do that? Yes, we do the allergic testing. We identify the causative allergen, and then we give that allergen specifically in vaccines in different increasing dosages to the patient, so that the body doesn't mount a response to the allergen. So we are kind of desensitizing the patient to the allergen, so that the response is not there when they come again in contact with the allergen. So I hope this information is going to be beneficial to you. In case you feel any doubts, or do not understand what should be the next line of management, you should visit your doctor. I'm here at the Manipal Hospital. You are most welcome to visit and see me. Thank you.